No, it's fine. Go ahead. Okay, so we're recording. She's recording for our class. Welcome to Healthy Start Childbirth Education Class 5.
Yay.
We're almost done. One more. Yay.
Are you guys excited?
Yeah. We're A+ students. We've been here a while.
Yeah, absolutely. And there is a prize in your future.
We promise.
It won't be rigged this time.
No, it won't.
Yeah.
It won't be
I
ready.
gave away crayons. What more can I do?
Which he forgot in my car. I'm like, are you trying to do an art experiment in the back of the car?
He's like, maybe.
That'll happen more than once.
Sure.
Okay, so list 3 things about your support person that will help you during labor.
Mom.
Oh gosh, 3. Oh jeez.
You can whisper them if you don't want him to hear you talking nice.
I think he'll be very encouraging. I do. Actually, he's been encouraging through the whole thing. He's been really, really supportive. I know he won't leave the room to find Pokemon. Because if he does, I will kill him.
He looked the other way. I don't know what that means.
He's like, if he
Virginia
does,
will be there for
if he
you.
does, I will be giving 3 reasons why Virginia is a better support.
Find that muck yet?
Still there.
And I know he'll handle everything as far as other people and stuff like that for me. I know he'll open up a can if he needs to.
Now, Chris, list 1 positive quality of mom that will help her in labor.
She's extremely strong-willed.
Very good. That is definitely gonna be a good thing. Set your mind to it and go do it. So we're gonna start with
over breathing.
Yes.
Yes. So this is
Do
the
this
one from.
every day.
Are you sure?
I'm
Do
gonna
you
be
know how to
good
do
at this,
it?
yeah.
Okay. Now there are 3 breathing techniques that you can use during the labor. So this we would have done a couple classes ago. So this is why it's in the beginning of this class. So we're going to go over breathing technique 1. So now, do you guys remember me telling you about signal breaths? A couple
Yes.
classes ago,
Yeah.
where you do 2 deep breaths
Yeah.
in and then you start. Okay. So that's what this one uses. So it tells you to get in a comfortable position. So during labor, that might be whatever position that you're using at that time. So it could be squatting, it could be in the chair, on the bed, whatever you're planning to use. And then you want to focus your attention on something. So that's kind of where I was talking about. You can hold your hand out and tell her to blow towards your hand because it gives her a focal point. You can have the pictures up, or it could just be your face, Chris. Whatever is going to help her focus, because you don't want her to worry about. That doesn't sound.
I shouldn't have laughed.
That's not a good idea for you.
I don't know. Maybe laughing is the way to go.
So whatever is going to keep her focused away from all the commotion going on in the room. So now I have it written up there. I'm going to read it first, show you it, and then we'll practice it. So first it talks about you want to use a signal breath at the beginning and end of every contraction when you're using this breathing technique. You want to use slow, even breaths for this one. And while she's breathing, you can rub where she hurts. So as long as you're not the focal point that she's using, you can rub her back, her shoulders, it might be her legs or feet, you never know. Whatever's hurting at that point, you can do that.
I think we should practice that part until.
Yeah?
Yeah.
I think so too.
I'm
on your
3
side,
on that
Katie.
one, so you know.
You can have Pokemon Go over here while you're doing it, you know, be like, oh, hold on, pause.
I do it with one hand.
Yeah.
All right, so you'll do a signal breath, slow even breaths, and then you'll do a signal breath at the end. And then you want to count for the contraction. So we'll do it for a 30-second contraction. So will you count 30 for me while I'm...
I sure will.
All right, so contraction starts. So
It's okay, honey. It's getting better. That's 30.
and that's breathing technique 1. Thank you for that.
You're a
Yeah.
phenomenal support person.
Oh, thank you.
She is. Okay, so you guys got that? Any questions about that one?
I don't think so.
Okay, so let's practice. So Get comfortable.
It's gonna be awkward.
It is awkward, but that's why I say stare at something. So I still left the pictures up, so stare at the pictures because
You were
it's
staring
less.
at the crayons.
I was actually staring at this paper. I was just like, because it is less awkward when you're not looking at each other like, I'm breathing right now. But it's
Especially when you're the only student.
I know. Well, he's practicing with you.
Oh, am I? Okay.
Yeah, that way we all kind of understand how it is so that he can look at you and tell, oh wait, you're not breathing, you're breathing too fast, you're breathing too slow, or your signal breath needs to be deeper, whatever it might be. So
And you guys are going to need this breathing technique for when this kid is a teenager, so you might as well start practicing
Yeah.
now.
Sure.
I think I've used it when I was working.
You used it with me.
Yeah.
at least he's honest.
Yeah.
All right, so contraction begins.
It's 30.
Contraction end. So you get the feeling of that. You can kind of feel it in your chest the way it works. Because that's what we're feeling for is the chest. Because in some of the other ones you'll see it'll say this one should be more shallow, this one should be more deep. So you're really looking to feel it in your chest. So any questions about that one?
Nope.
No? Okay. Next one. Breathing technique 2. So this is the light chest breathing or modified pace breathing. The one thing to know about this is, Chris, you're really going to want to watch her because you don't want her to hyperventilate either. So this one can, it does run the possibility that if she does it too quickly, she can hyperventilate. So this is a faster, shallower type breathing. You want to use this when the contractions are getting stronger. So in that transition period, possibly earlier if she wants to use it earlier. So just kind of feel her out and see where she's at and what she wants to use. So this is a higher breathing in the chest, so you're going to feel it up here rather than this one you felt kind of down here in your core. This one you're going to feel a little bit more up here. It's usually in and out of the mouth rather than your nose, so your mouth is going to get dry. And then important to get enough air without over breathing. So you can use a pattern. I didn't put an N at the end, my bad. A pattern, not a pattern. Oh, my bad. To help prevent this. So again, I kind of use the same pattern as the first one where, as you're breathing, because this one, if you see, it doesn't say that you need to use a signal breath. So you just start breathing this way, and I kind of use it the same pattern as, you want to breathe in and then breathe out as long as you can. Breathe in, breathe out. Just don't do it too shallow, and you don't want to do it too deep either. So your example. Give me a 30-second contraction. Tell me when the contraction starts.
Start. Okay, you're good.
So you see that I'm not breathing too deep, and I'm not doing it too fast either. And as I felt myself getting a little, like I was going too fast, I kind of slowed myself down a little bit because I could kind of feel myself getting a little lightheaded. So just be careful of that. You might not be able to tell that you're getting lightheaded.
I refuse to leave y'all hanging. I'm so tired, bro. I say we got 2 more classes. I ain't no quitter. How's everybody?
Good.
How are you?
I just told y'all.
We're just going over some breathing techniques, so I know that you probably are already good with all those, huh?
Listen, this is for real. I was just thinking about this outside. Even though I already have 5 children, I have really learned a lot in this class. Like
Good.
things that I really
Glad to hear it.
didn't know, It doesn't matter how many kids you got. It just don't mean that you know everything. That you know.
Exactly. And every pregnancy is different. So,
This one is the hardest.
is it?
Yes, Lord.
All right.
That's what's also good about the PAT program, Parents as Teachers. I mean, I have 2 kids, and I still learn stuff, and I'm like, oh, that's why they were doing that.
Seriously.
Yeah.
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 Mhm. So I'll catch you up on the breathing during break then,
Okay.
so that you can get a good feel for them. We just did the second breathing technique, and we're actually going to practice. So if you want, you can practice with us, or you can wait. This is a light-chested breathing, so you want to feel it up high in your chest, and you just want to watch yourself. You don't want to hyperventilate. So it's going to be a higher rather than. And this is also where like Lamaze comes in, where they do the. That's like one of their patterns that they use to kind of monitor they're not over breathing. So we're gonna practice. Are you guys ready?
So ready.
I told them that they could focus on something else in the room if it felt awkward.
Just
So
gonna stare directly at you.
I did that with her.
She just did that this time, and I started making faces. She just did. I was waiting for her to quit, but you know.
All right, so this will be a 30-second contraction, and start contraction.
You're good.
All right, and contraction. So.
I hope all my contractions are this evening.
I know, right? You can have a dozen kids in this
Right. So did you guys all feel that up in your chest rather than
Mhm.
deep in the core? Anybody have any questions about it? No? Okay, so the next one is going to be pattern pace. So this is more of the and things like that. So this is talking about the same plus blowing out in a pattern. So I kind of showed you the way we were doing it is less of a pattern. So this one we're going to do, it's going to be the same thing. It says blow out every 4, 5, or 6 breaths. I suggest you go lower and then see what you feel comfortable with, and then you up it. So this is, I hate doing this one. I always get confused. So let me practice it first to make sure I got it. So it's breathe in and then out every 4 breaths. So I almost messed this one up.
Right? Am I right?
I think so. This one's gonna be hard. Okay. I can't do it. I don't know why. I did this in the last class fine. I don't know why today it's just not clicking in my head.
It's the he hoo, he hoo.
Okay, so
yeah.
I think what I didn't write up here because it didn't say it directly in the curriculum is that you have to take a deep breath first. I think so. I think you have to go. And when you do the you can almost feel a little bit of air coming in. So doing the 4 breaths would be. So let's go ahead and just practice that one without doing a whole contraction. So everybody take a deep breath in and then do the. We'll do 4. Sorry, it takes me a couple minutes to get that
Whitney,
one.
are you breathing out or in?
You're just kind of going. You're not really breathing
Oh,
in
you're
or
really
out.
breathing it out.
Mm-mm.
Oh, okay.
You're just trying to make a noise to take focus away
Off the
from the
pain.
pain
Okay.
and make noise in your face. And I mean, you can almost do this in any pattern you choose.
Okay.
It's just, I mean, sing, you can dance, anything that you have to do. This is just the breathing technique.
Okay.
Exactly. So 1, 2, 3, start. Alright, good. Good job. You guys have any questions about that? Again, I'm sorry, it just didn't click right away. Next page.
Nope, breathing to prevent.
Oh,
pushing.
that's right. Okay, so now we talked about this earlier. Remember I told you in another class, I'm going to tell you how to use this so that you can help her stop pushing if she doesn't need to push. So if they tell you she doesn't need to push and she goes, I have the urge to push, this is the breathing technique that you want to use. And basically what it is that, and it talks cause from baby moving down and all that. You want to blow out with short, light breaths. And what I would tell her to do is do the feather. Be like, there's a feather right here, you need to keep it from touching the ground. So it's a. So that's how she needs to be breathing, and you need to encourage her to do that if they tell her not to push and she feels the urge. So you want to practice that, Katie and Sandra?
Sure.
All right, put your feather in front of you, and then just.
out of here.
You're so carried with our reading techniques, Chris.
Trying to help.
They're supposed to be practicing.
So can you imagine keeping a feather up? Kind of like when we were kids, we used to do that, you know, try to keep something from it.
And I have to tell you, if the doctor is telling you not to push, there's a reason. Don't push.
Mhm.
You've got to not put pressure on the baby. It could be the cord. It could be something. Just don't do it.
It could just be because the person that's going to deliver is not in the room yet, and the nurse that's there isn't qualified to help. So, like, they're qualified to help with labor, but they're not qualified to pull that baby, so, or catch the baby.
Do you know they have to do a certain number of babies without a doctor every year?
You never
Just
know.
saying.
I'm just saying, you never know what the reason might be. So,
Oh, next.
all right. So, what do you think when you hear the word birth? Chris, we'll start with you.
I mean, it's totally a cop out, but I think baby.
Okay.
That's the first thing that pops in my head. So, next. Did I steal yours?
Yeah, mine.
You don't have to answer, Chris.
He doesn't feel bad.
There's so many words that go along with birth, like birthday, birthday suit.
Well, and it's word association, so the first thing that pops in your head when you hear bird.
Yeah, I don't know. I don't know other than having a baby, like pregnant or having a baby.
Okay.
Can't steal mine.
Shut up.
Contra?
Same. I mean, the first thing that I thought about was baby.
Hi.
Well, mine was messy. Birth is messy.
I thought child, so childbirth. So baby child.
I always think kids just because I've had to, so whatever.
So I'm the weirdo. It's all good.
You're a nurse.
Yeah, no, that's true too.
What do you think when you hear the word medication? I'll start again with you, Chris.
I think of being sick.
I think of relief sometimes.
That's true.
Okay. I guess I would have to say. I don't know really. Medication. I mean,
Well,
probably
that's-
sickness, some type of sickness or pain.
And it can be just a positive or a negative feeling too. So if medication to you is a good thing, that's okay. If it's a bad thing, then you would have a negative feeling. To me, I think about school because that medication class kicked my hind end. But anyway, go.
I think ick because I absolutely hate taking medication and I would rather be almost dead before I'll take anything. So
I'm with Jennifer. I think not good. Because I get every night, like if it has a whole list of, like when they do the little fast talking, it might give you this and this and this and this and this. And I get all of those things. So I'd rather just have a migraine than deal with the rest of it.
And have you thought about if you're planning to use medications during birth?
I have to say, she changed my mind when we talked last week
Really?
about as far as waiting. Yeah. Like I told Chris, I'm like, I definitely want it in the room just in case, but I
think
will
that-
try to make it as long. I think I was gonna try to make it
Yeah.
as long as I could anyway, but
But I think
her
that,
perspective
yeah.
changed it a little bit too. So.
Oh, that's
That's
so
good.
nice.
I'm so glad you came on.
Absolutely.
Thanks for sticking with us.
And the other thing is, I've heard this perspective before from a mom who's had a few kids. That, you know, I've done it both ways, and I got the epidural and I regretted it because I didn't need it and it didn't work anyway. That's what I've heard. But in the end, it is your personal choice. Everybody's personal choice.
I don't plan on using it when I have a child, but again, you heard my views on medicine, so. Do you have any say in whether or not you use medications during labor?
Me?
Yeah.
Yeah.
Yes.
Him, no.
I'll use whatever medication I need.
Alejandra, do you agree?
Yeah, I agree with that. I know that, you know.
I
I
think
mean,
as,
who else is gonna make the decision?
as long as it's not something that will affect me negatively, if
Yeah.
the doctor says I need it, then
Right.
I need
That's
it.
what I would say, to a certain extent, yes,
Mhm.
as long as everything's going normally, it's gonna be fine, but if they need to take you in for an emergency C-section, something like that, you will end up getting medication, so.
It's definitely one of those things where it's your choice. It's your choice. And a lot of medical professionals, no offense to you, but they want to push that because they know you're in pain and they want to ease your pain. They want to make it more comfortable for you because that's their job. And so they will offer it, sometimes more than you want them to offer it, and being adamant, having good support system there behind you to say, no, she wants to try it this way, and I want to do it, I want to do it the natural way. It's good.
Having the support
There's
person
good
to
nurses and good
communicate for
doctors,
you.
and there's not. I know.
So it's good to have like Chris there, and they come and say, "Oh, do you want that epidural?" And he goes, "No." She said no.
Yeah.
So having that support person there to say no.
Okay. So, is this me or you? I don't
You.
remember. It's me. Okay, so the use of medications. Medications are tools that can be used during labor to bring pain relief. There's more than one type. I know a lot of people simply talk about epidurals, but there are others. So the first one is a sedative. And so this would be like your Xanaxes. So let's give you this and let you take a nap. Okay. The next one is a tranquilizer, and this is one again that's going to make you sleep. Okay. This might be good in the beginning of labor. You know, you get there, you're 2 centimeters, you're contracting, but you're really tired. Maybe that's a good thing. And if you're only 2 centimeters and contracting, it's going to be a long time before you have the baby. So some of these drugs are okay to use in early labor depending on your personal views, your doctor's views alike. The next one is narcotics. This is like morphine. There are a lot of women who take morphine to take the edge off contractions in beginning of labor and take a nap. Okay? You cannot have that when you're closer. You can't have any of these when you're closer to having the baby. The big problem with narcotics especially is that they can depress your respiratory tract. So if you take narcotics and have the baby right away, they can have trouble having the baby breathe.
Okay.
So you take it in early labor, yes. Later labor, no. And then anesthesia. Anesthesia is your provider taking away your pain. So this is your epidural or even general anesthesia, which they're not going to do unless there's some kind of big issue, regional in general. In fact, the only time they're going to do general anesthesia is if you have a screaming emergency and you have no epidural. And then local infiltrated, such as anesthesia and a prudential block. Prudential is when they put it in, put needles in around the vagina. So you're not going to feel the vagina stretching as much, but you will still feel the abdominal pain. And then epidural, caudal, and spinal, which are all kind of the same thing, putting medication in the back. There are lots of risks and benefits. So sedatives can ease anxiety, help with sleep, are used most effectively during slow starting labors to help you sleep. Sleep and rest are going to be the two biggest things of labor. They can reach the baby, and yes, there can be some side effects. On tranquilizers, they help you relax. They can also help stop nausea and vomiting, and can be used alone, especially if the mother doesn't really want narcotics. Can be the suggestion if the mother really wants to relax or is having a lot of nausea, doesn't really want the big epidural. Again, this is medication that can get to the baby. Everything can have a side effect. Narcotics, it decreases the awareness of pain. You would still have pressure. You would still know when you were having contractions. It can take the edge off and make contractions more tolerable. But it can cause sleepiness and cloud mom's thinking. It can affect people in different ways. So there are people who have, say, hallucinations on narcotics. Contractions will still be felt. They'll just be a little better. These can definitely reach the baby. You're okay. And again, everything can have a side effect. Narcotics decrease the awareness of pain, can take the edge off and make contractions tolerable, can cause
I
sleep.
don't know if that's why that's there twice.
I know, I was looking at that.
That's probably my fault.
Okay, so anesthesia. Regional anesthesia numbs pain pathway to the brain and the ejection of anesthetic around the nerve pathways. So, regional anesthesia. So this would be like getting a shot of lidocaine to sew you up. So if they were going to do that after you'd torn or something, that's what this would be. Anesthesia by injection can allow the mother to stay awake but not feel pain. And can make pushing more difficult if it's, they've given you that prudential block and you can't feel where to push. can be transferred to the baby. Anything you take in, anything you breathe, eat, can go to the baby. So general anesthesia, this means that they put you to sleep. Mom is asleep. Side effects can be nausea, vomiting. After general anesthesia, you're normally pretty tired for the first couple of days afterward as well. Some women also don't wake up real well. So I know a friend that wakes up fighting.
I wake up vomiting.
Huh?
I wake up vomiting.
Okay. And usually for cesarean births when the mother does not wish to be awake or the baby needs to be born without delay. Local infiltrate anesthesia or pudendal block given before the episiotomy is done and the baby is born. Can have side effects. The epidural, the caudal, and the spinal. The difference between the epidural and the spinal is that in an epidural the little tube stays in. It's not a needle, it's a tube. Whereas in a spinal they put it in and take the tube right out. So they're only really going to do a spinal if you are having a C-section. And they only need it to be numb for a few hours. If you're going to be in labor, they're going to do the epidural because they really don't know exactly how long it's going to be. Mother may not be able to push effectively or actively. If you can't feel how to do it, how do you do it? Your legs may not be able to move, so you wouldn't even be able to turn your feet over usually. In slow labor, the mother's not able to